Yes, hello everyone. So today we are going to talk about the safety and the air and at work, at work. So it will be an Attentia Aviation medical approach. So welcome to the Pilot Expo. Nice to meet you all. So who are we? Donc, Brigitte?
So I'm Dr. De Geyter. I'm head of the AeMc, Aeromedical Center, Attentia Aviation Medical. I'm AME class 1, 2, 3, LAPL, I'll explain that all afterwards. Member of the Appeals Board at the Ministry of Communications and member of the Administration Board of the Aeromedical Association of Belgium, AMABEL, which is also an interesting site.
So I am Farah Maamer. I'm a team leader at the Occupational Health Service at AeMc, how we call it, and I'm a occupational health physician. So here you can also find our info if you need to contact us. So what about Attentia Aviation Medical?
So we have Attentia Aviation Medical is 2 centers in one location. So the Aeromedical Center and then the Prevention and Protection Services.
So we are not a new center. So it's a center that's since 1928. It was previously called Sabena Medical. Then it was Brussels Aviation Medical, and today it's Attentia Aviation Medical. So what's specific for us is
that both examinations are available in one place at Attentia Aviation Medical. They can be performed separately for EASA members or companies or for initial examinations, or one after the other within the same half day for flying personnel.
Yeah, so Attentia Aviation Medical is in few numbers. So we
do approximately 2,600 examinations per year. For professional or recreational pilots, air traffic controllers, cabin crew, LAPL, pilot licenses are in accordance with the European Aviation Safety Agency at the European Union for Aviation Safety and under supervision of the BCAA, Belgian Civil Aviation Authority. Voilà.
And we also perform approximately 4,500 examinations in the occupational department, and we do risk analysis, internal prevention and protection. It's for affiliated companies personnel. It's also under the Belgian occupational health and well-being legislation, so it's the Codex in Belgium. So we combine in the same location and within an integrated medical team, EASA expertise, so fitness to fly, and also the occupational medicine. So let's start with occupational medicine. What is an occupational physician? So occupational physician focuses on prevention of work-related health risks. We do medical surveillance of employees, advice to employer and employees on health, safety, working condition, also preventive medical actions like vaccination, etc. So the role of occupational physician for flight crew specifically requires a deep understanding of several things like fatigue, sleep management, circadian rhythms and time zone disruption, all the mental workload, the cognitive performance, the long-term cardiovascular risks, ergonomics also in the cockpit environment. So to summarize, occupational medicine for flight crew is not just prevention. It's about protecting performance and maintaining abilities to work. We have also well-being and safety health at work department that focus more on occupational safety, risk prevention, workplace ergonomics, and also all the legal, fire, hygiene, and hazard advisory support needed. We have also psychosocial support, so for all the stress management in high responsibility environment, like for flight crew. We also do prevention of cognitive overload. It's all in a trusted and confidential environment, so it's strict medical confidentiality, a safe place for an early discussion. So also we do guidance and mediation. So if professional is facing workplace difficulties or a medical assistant in case of harassment, for example, or a complex situation at work. Here,
So what is an AeMc, aeromedical examiner? It's a doctor specialized in aviation medical. We assess medical fitness to fly in accordance with EASA regulations, ensure that pilots, also ATCOs, cabin crews, meet the standards, and focuses on interaction between health, performance, and flight safety. It's very important, in fact, to do that medical examination. It's mandatory each year, but you should also do this before starting flight school, because before investing a lot of money in flight school, it's better to know if you're fit or not.
So here we are going to talk about the different classes of license that exist. Maybe you know a few of them.
So you have class 1 is a commercial pilot, professional pilot. You have class 2, private pilots. We do class 3, which is ATCOs, also cabin crew medical examinations. Everyone has to meet the medical standards or requirements for his class.
And what is specific also for our aeromedical center is...
So what we have in our aeromedical center is that we have a lot of specialists trained in aviation medicine who are available for consultation, such as an ophthalmologist, an ENT specialist, a cardiologist, a pneumologist, a psychiatrist, a psychologist. They all can give advice and help to solve problems.
And also, it's really important to know the complementary of medical expertise at AeMc.
So those two examinations, aviation medicine and occupational health, are really two different examinations. Aeromedical medicine is only expertise. We can do only expertise.
And
you can do only occupational medicine.
So occupational health, it's all about prevention, monitoring, and long-term health protection.
So this is for companies. Once you're in a company, you need, in fact, both of them. You need the EASA card, but you also need to undergo the occupational medicine.
So what we do here is through medical history, anamnesis, clinical examination, and we provide also medical personalized advices, and we give an appropriate follow-up and support regarding the different situation. So protecting crew health directly contribute to aviation safety. It's also we need to remind that.
So our goal is really to keep pilots fit to fly. That's our goal.
Yeah. So here it's really important also what we said earlier. It's one day, one place, and fully coordinated coordinated expertise for
initial class 1 examination.
And what does that mean?
It's everything in one day. So you have to undergo different examinations. You have to undergo pneumology, cardiology, ophthalmology, ENT, a GP, general doctor, a psychologist. Everything is done in one day, and then it's finished.
So here we have a checklist with all the exams that a pilot class 1, so students that will start to be pilots. As earlier the previous person said that sometimes we invest a lot of money, a lot of time, but we are not sure that we will be medically able to work as pilot. So here are the different steps and what to bring with you if you are going to undergo any one in our center.
You find all this on our website also.
Yeah. So we specialize in conducting comprehensive aviation medical examination for aviation professionals and also putting flight safety first, protecting your health in the air and in your workplace. So both are important. Here we have some safety success stories, let's say so, and that's the result when prevention pays off, and it's the safety in action here.
So what did we find? A few examples. We found a pilot with hematuria, blood in the urine. Further investigations revealed an early bladder cancer, which was treated on time, just no problem for him and no problem for his license, because both really go together. A pilot with asymptomatic cardio-arrhythmia were found during an examination. So the early detection also prevented complications. Everything could be treated. Cabin crew member with a heart murmur, we found a large aortic aneurysm, which could be treated urgently, just on time, so no problem.
So here it's really the impact of the several medical assessments that lead to life-saving diagnosis among crew members. So it's really important to know that. So this also contributes to flight safety. So beyond the diagnosis, which can save lives indeed, like Dr. De Geyter said, it helps to reduce the risk of in-flight incapacitation. So if a person with aneurysm of the aorta on the flight have a medical situation, it's not a good end. So where to find us? So
you find us at the airport, so we're not far from here. Brussels Airport, Building 26. This is our telephone number, our email, and our website.
It's really behind the Brussels Airlines buildings. So thank you all for being here, and if you have questions, don't hesitate to contact us. Voilà.